Okay, hello everybody, welcome back. We have another interview for you today. I am absolutely delighted, overjoyed and overwhelmed to be joined by the inimitable Dr. Ally Jaffee, who's one of the co-founders of Nutritank, quite outspoken advocate for, I would say, mental health, physical health, nutritional health, lots of types of health. And all sort of everything that comes along with that, really. And it's a very wide panacea of things that I think we've got to talk about. So Ally, welcome on.
Thank you so much, Ollie. So nice to chat to someone at the same level and who's so passionate about med-ed just like we are. So really nice to be here.
What Ally's referencing then is literally just before we started filming, I was saying to Ally that I myself wasn't sure what grade of doctor she actually was, has this sort of air of knowledge and confidence and stuff. I thought she was an SHO, a doctor a year older than me, who knew infinitely more than I did. I'm sure she does know infinitely more than I do, but is the same grade.
I very much take that because, wow, haven't heard that one before, let me tell you now.
Do you just want to, before we jump into the sort of wider talking points, Ally, just give us a bit of background on who you are, what your role is kind of right now, what you're doing now, and then we'll carry on.
Yeah, so hi everybody, I'm Dr. Ally Jaffee and I'm a foundation doctor living in London, but I work just outside of London. I finished medical school like Ollie in the pandemic, which was a very interesting experience, and I studied at Bristol for 6 years. I took a gap year before I started medicine, as I didn't get in first time round, and I'm very passionate about saying try again. And we can go into that more further along. And I also intercalated at Imperial College London, doing a BSc in medical humanities and creative arts between years 3 and 4 of medical school. And I'm very passionate about mental health and holistic healthcare. And I guess my favorite special interest area is bringing together nutrition and psychiatry in this amazing new field, nutritional psychiatry, which looks at the nutrition interventions to prevent mental illness as well as manage symptoms around mental illness. So yeah, that's kind of me in a nutshell. Proud co-founder of Nutritank, which is a hub of nutrition, lifestyle medicine. And yeah, great to be here.
There's so much to unpack. Whenever I start speaking to people at the beginning of these interviews, I always have this very panicked moment, because clearly there's a lot more going on than even I knew sort of on the surface level, and it would take hours and hours and hours to do it all justice. I think just for the sake of brevity and keeping to sort of the key ideas here, you used a term when you were giving your introductory paragraph, then this idea of holistic health and holistic medicine. What does that mean to you?
So to me, that means, and I think, it'll mean different things to different people, but to me, it's looking at the person in front of you and looking at them as a whole. So whole person care, and thinking, how can I help give this person tools to manage their everyday symptoms of their chronic condition in a holistic manner that goes beyond pharmaceutical interventions and surgical interventions. So how can I empower them to find ways for them to manage their well-being, to manage their chronic pain, etc., whether that's movement, whether that's the arts, whether that's nutrition. That is what holistic healthcare means to me. So just really getting to know that person and meeting them where they're at, and trying to just nudge them with a few suggestions of what they can do to help themselves and, join a community that maybe they never thought about joining before.
And you mentioned an interest in psychiatry. Then, I mean, I suppose if you have this special interest in talking to people and having a more sort of in-depth relationship with them and discussing all of these different options, then psychiatry is definitely one of the specialties that lends itself to that. Is that where that interest comes from?
Absolutely, Ollie. I'm such a talker, and it's just my favorite thing, really using my words as the kind of medicine and the tools, and the scalpel, which I can see the interest in, but I find it really challenging and also fulfilling trying to use the art of language, and whether that's verbal or non-verbal communication to really help that person, get them to open up to really help them in the way that they might not even know that they need to be helped in. So for me, talking and delving into someone's past, present and future is definitely where I see myself going.
I think, want to jump straight into the Nutritank stuff and this idea of nutritional health, because I think there's a lot of different angles to consider this from. Maybe let's start, for those who are unfamiliar. When I was at medical school, I remember a Nutritank presence then, particularly in maybe the last couple of years of my course. I think we had a Nutritank society, and it was a brand that I'd kind of heard of, or an organization that I'd heard of. For those watching, would you mind just spelling out exactly what Nutritank is?
Yeah, absolutely. So my co-founder, Dr. Ian Broadley, who is an F2 in Sussex, we started Nutritank in our second year of medical school, and we're coming up to our 5th birthday of Nutritank in June, which is really exciting. And so we started it because we saw a massive gap in our medical education right from the onset when it came to being able to discuss diet and lifestyle with patients. Mm-hmm. And we were sat in our lecture theatres, going through the kind of biomedical motions of a medical degree. And we were learning the physiology, the biochemistry, and the anatomy of the digestive system. But what we were never covering was just how powerful nutrition interventions can be to not only prevent chronic disease, but also manage symptoms of chronic disease. And, this just didn't seem to be anywhere in the lecture slides. And it goes far beyond, the digestive system. When we were sat in cardiology lectures, oncology, etc., diet and lifestyle just never was mentioned. So we thought, oh, there's some sort of disconnect here. Started digging a little bit deeper into it. And we found that all the NICE guidelines for chronic conditions, so for your audience, NICE guidelines are the treatment guidelines that UK doctors and healthcare professionals are governed by to help guide them manage all the different conditions. And the first line management of every chronic condition, from diabetes to polycystic ovarian syndrome, is to offer patients diet and lifestyle advice. Mm-hmm. So it's given lip service, but there's absolutely no training and education as part of teaching the past generation of doctors and the future generation of doctors on how they can actually speak to their patients about this in a meaningful manner and help, get them onto that behavioural trajectory with making diet and lifestyle changes. So Ian and I thought to ourselves, wow, we have got to do something about this. It's just so important. We know lifestyle related disease is on the rise. Mm-hmm. And it just seems like we need to have a healthcare system fit for the current situation we're in, rather than just acute medicine. And so we founded Nutritank. It took a while to come up with the name, but essentially it is what it is. In the name, it's a think tank for nutrition and lifestyle medicine, and it's evolved over the last few years into a real hub for food, nutrition and lifestyle medicine. We almost want to be like the Amazon marketplace for all things nutrition and lifestyle medicine, so you can find the most credible educational courses and get discounts on them compared to going direct to the source, and get discounts on different health and fitness and well-being apps and products as well. And the thing we're really most passionate about is making sustainable change. So we have essentially taken a bottom-up and top-down approach to bring around this kind of paradigm shift. And we, in October, along with loads of other collaborating organisations that we've been working with for the last 3 years, we actually had the GMC accredited nutrition curricula for undergraduate medical students launch, which essentially ensures that all future generations of medics will be taught about nutrition. And that's kind of where we're at. It's been really exciting. And when Ollie discussed that he had a presence, you were at what medical school again?
Warwick.
Warwick, yeah. So there was a Warwick Nutritank Society. We have 2/3 of UK medical schools with Nutritank societies, which is really about our bottom-up approach in getting as many communities across the country in different medical schools. And now we've launched our junior doctor network. So we're looking for that same representation in hospital trusts. And we're trying to recreate this community of like-minded individuals who can be activists in their own local areas. It's not about Ian and I, it's about really creating this brand and getting people on board to really promote this change.
Amazing. I mean, you guys, both from what you've said then, but from what I've seen, and I should say, this is from myself, the perspective of someone who is not, or historically has not been, especially interested in nutrition as like a field of science or medicine, other than I do agree there's this, I think we have this consciousness, all of us, whether you're medical or you're not, that nutrition and lifestyle clearly are very, very important. But certainly my experience in medical school, I think charitably, we probably had between 4 and 6 hours of nutrition education across 4 years of medical school. Like you say, there's a very biomedicalized approach to everything. I guess you learn about how fats are metabolized and how iron and magnesium and all the other sort of important minerals and things that you need are, and you learn how the body processes them, but it's never really viewed in that way, is it, of how people are actually taking all of these things in?
Absolutely. It's not the Krebs cycle and all those kind of very molecular aspects of nutrition, which are obviously super important, but at the end of the day, they're not that meaningful to that patient sat in front of you who is just kind of at a wit's end with whatever kind of non-specific symptoms they have, and you can them with their diet and lifestyle.
I mean, that talking point basically, I think, forces my hand in asking, because in medicine we often take, often for very good reasons, we take this depersonalized, biomedicalized approach to problem solving, because that's the paradigm in which we learn, as you said. Did you meet any resistance when you were trying to introduce this more not nebulous, that's not a fair characterization, but a less biomedicalized approach?
Yeah, absolutely. So at the start, we were both at Bristol, and we had some amazing lecturers and GPs who were really on board and had kind of championed nutrition and lifestyle in their own practices already. But we definitely had some senior members of the faculty that just didn't see the point and took the kind of mantra of, well, if I didn't learn it and I've got to where I am today, why do you need to learn it? And I thought that was slightly short-sighted and discouraging. So the way we had to work with those kinds of people, and there were many of them, and it wasn't just at Bristol, nationally as well, when we'd get into conversations with people at conferences, and we'd be interrogated about how feasible is this even to action. And how we kind of dealt with those types of people is we went away and we surveyed the nation. So we collected data on medical students and junior doctors' opinions on nutrition. And essentially, we then got that published in the BMJ.
Well done.
And it was a very collaborative survey with lots of other different organizations that we work with. And the paper's called Time for Nutrition Education. And the main thing that we want to demonstrate to the people that are resistant is that the reason why people didn't feel that they were able to give diet and lifestyle advice to their patients wasn't actually due to a lack of time. It was due to a lack of confidence. And how do you become confident in something and competent in something? Through training, through education. So the main kind of argument that the people that were resistant were either, well, I'm a successful doctor, I do really good by my patients, but I never had this knowledge. Why do you need it? And curriculum crowding, there's such a lack of time. How is it ever going to be feasible? So we essentially showed them the incredible research basis showing the power of nutrition interventions for reversing or managing chronic disease. And the ones that were saying lack of time is the main factor, we said no, actually, from a huge sample of data, it was actually a lack of confidence, and they are really up for it. And it's not about making it a standalone module, it's about really integrating it into all the education that's already there. We're just saying have a couple slides in a cardiology lecture looking at the importance of a Mediterranean diet for patients who've had previous MIs and things like that. There's so much data to support it, and it could just be put in there very easily, and you can just literally mirror the NICE guidelines and say first line management, diet and lifestyle advice, pharmaceuticals, surgery, and that is how you can teach it to students, and it makes sense. So there definitely was, and it kind of disempowered us at times. Like it wasn't, no kind of entrepreneurs journey is linear. There's definitely been ups, downs, and kind of setbacks and things along the way, but we tried as much as we could when it was a resistant person or group of people to really just prove them wrong, essentially.
And that's really hard, because especially when you're medical students and you don't have that medical pedigree of even being a doctor, right? Like if you're going to a cardiology consultant or whatever who isn't interested in what you've got to say, and you've got these two upstart medical students that aren't even qualified yet, and they're trying to change the curriculum essentially, but yeah, here you are, you did.
Yeah, no, that was tricky. I can't say it wasn't. And I really don't like this phrase, this imposter syndrome phrase that comes up on social media the entire time, because I think it's quite disempowering as a phrase to say that, you're constantly feeling like an imposter of the position that you're in. And like for myself and Ian didn't get into medicine first time round, did an undergraduate degree in biomed at Sussex, and then came to Bristol. I didn't get into medicine first time round. I tried again, got into Bristol second time round. Like we both worked so hard to be there, and we knew we were going to be future doctors. And whilst we did not have the clinical expertise at all, we had the kind of confidence in ourselves to realize that something wasn't quite right. We weren't serving the patient population as well as we could with the current situation we're in Western society, with all Western trends of sedentary lifestyle, processed food, etc. Yes, we are medical students, but we have worked really hard to be here, and we really, really want to contribute towards bettering the profession. But we're not going to be arrogant about it. We're going to get a board of experts, more senior doctors who already have been trying to do this in their own profession for a really long time, to also back the cause and things like that. So it was more of a community effort, because otherwise you do put yourself in a slightly vulnerable position, I guess.
Yeah, and that's actually a really interesting point, because as somebody, especially now who is maybe active on social media or monitors social media, something that I find or observe about medical social media at the moment is that we have a lot of movements that appear, which might be the adoption of nutrition education, or these other movements that medical students are able to take forward, and they are rightly lauded and celebrated because it is, an inspiring young person or a team of young people taking these ideas forward. When the reality of the situation often is, as you've said, that many fully qualified doctors have been pushing for these things for the last 50 years, but have never gotten any airtime, and no one's interested.
Interesting.
What do you have any thoughts, or why is it? And I'm not saying this is a bad thing at all. I think it's an excellent thing. Why is it that two 21-year-olds are able to take this forward when, you're presumably there are many consultants out there who have been pushing for nutrition education for years?
Yeah.
Why haven't they been successful?
It's actually such an interesting question. And with all the conversations I've had, I've actually not had this before, but I've thought about it before. So It's a tricky one, and I would say that on the whole, we've had senior clinicians say, honestly, I'm so proud of you guys. Like when I was at medical school and I was talking about this, I was a black sheep, and I never got anywhere because there was a lot of kind of discrimination towards my views on the situation, and blah blah blah. And so I'd say on the whole, the support we've received has been incredible, and they've kind of served as mentors to us, and they're on our expert advisory board on our website, etc. But I think the reason why we have been potentially more successful has come down to timing and social media. So having a non-hierarchical platform where everyone is able to have a voice, whether you are from any part of the world, from any background, as long as you can get access to the internet and you have a phone or any device, you have this incredibly inclusive, obviously there's loads of issues around Instagram and other forms of Twitter that make it not inclusive, but you have overall a very inclusive platform where you can say whatever you like, and it's open to the public. You will get hits, you'll get views, things will go viral, etc. So that has really allowed us to gain momentum and connect with as many like-minded people who are singing from the same hymn sheet as us. Whereas prior to that, it just seemed like an unsolvable problem if you didn't have a platform like social media and you were just doing it through word of mouth and the kind of old-fashioned way that things were done. It would be really hard to get anywhere, and it would be incredibly disempowering if you were having to email round or send letters to deans or whatever. So I think that social media and this kind of modern startup culture of millennials being disruptive has really played to our advantage. So I think timing has been a huge thing, as well as the hierarchy of medicine is slowly but surely, obviously not in traditional specialties like surgery per se and other really senior led specialties like peds, of course not. There's a reason for things needing to be really senior lead with specialist care, but the gaps are socially starting to feel a little bit smaller, like going for coffee with your consultant and just having a very genuine conversation that doesn't have all this hierarchy attached to the role. So I'd say timing has really helped us. Things have become more modern, more accessible, the accessibility of social media, the inclusivity. So I think that's probably why we have had such luck and success, is because we've shouted about something. We've not just shouted about it, we've done something about it, and we've got that message out to the masses. Whereas people in previous years have probably kind of been shunned socially for going against the status quo and things like that. But I think, I don't know about what your thoughts are on this, but kind of young activism is becoming, a much more prevalent thing. Look at Greta and all these different types of people around the world who are trying to change social, economic, and kind of healthcare issues at a really young age. So I don't know, quite a long-winded answer, but very interesting question to look at the generational differences.
Yeah, I'm sorry, that was maybe more disruptive than I meant it to be. No pun intended.
It's so good what me to think, Ollie. I loved it. It was a really, really good question. I really find that interesting.
It is a really interesting question about young people's activism and why they're successful when maybe the internet is the answer. Maybe it is as simple as that. I do something that running, I mean, obviously I got into social media via the whole the YouTube sort of end of things and running this channel on which we're talking and things. And I think I have become increasingly aware that when younger people speak out about things, I think there is a danger of us lacking perspective. And I think this is only something I've realized by oftentimes watching back my own content that is now, out there on the internet. I'm 25 now, and I can look back at content from, even me like 4 years ago when I was 21 and thinking, God, what a stupid idiot. He doesn't know anything about anything. And here he is like mouthing off about this. But like you say, that there is a difficulty that if people didn't speak out before they felt they had perspective, we'd never get anything done.
I genuinely back that to the end of the earth, what you just said. I think that should be a slogan somewhere. I back that so much. Why wait? If you have an opinion and you've got the evidence to show that what you're talking about isn't, very short-sighted and not well thought out, speak up. 100% agree with that.
So on the topic of evidence, here we go. It's not going to be an especially challenging question, I would hope, but with the disclaimer that everything that we may or may not discuss in the next few minutes is not medical advice, are there any interesting or sort of well-known case studies or anything we can talk about, like one example of a chronic condition that is amenable to being managed with, say, changing your nutritional status?
Yeah, absolutely. So there's some great studies which I can link you if you want.
We can pop in the description. Yeah,
absolutely. So a few studies that I guess are just, pretty great are so the Lyon Heart study, which took place in Lyon, France, and it looked at when healthcare professionals advised their patients who'd had previous MIs, heart attacks, around Mediterranean diet principles. The patients actually had about a 44% reduction in having a recurrent MI. So yeah, as well as the Lyon Heart study, because I want to do psychiatry long term, one of my favorite studies is the SMILES trial, which was conducted by one of my biggest role models, Professor Felice Jacka, who is kind of the world's, nutritional psychiatry expert, if you like. So she's based in Australia and runs the Food and Mood Center. She is a psychologist by background or a clinical epidemiologist. I can't remember, but either way, she created a trial called the SMILES trial, where she got a population of Australian women with major depressive disorder and split them into two groups. It was one of the first randomized controlled trials looking at nutrition interventions for mental illness. Put them into two groups. One group carried on with their antidepressant and talking therapy, and the other group just essentially went on a Mediterranean diet called the ModiMed, which was a modified Mediterranean diet based on Australian eating patterns.
So sorry to cut you off in the middle of a flow, but I'm just conscious we keep talking about this Mediterranean diet.
Yes.
For those listening, what does that mean for those of us?
Yeah. So the Mediterranean diet actually has the richest research basis in the nutritional science world. And obviously it comes from the Mediterranean, so Greece, etc. And it basically looks at having whole grains, so having less refined carbohydrates and more whole grains, so whole wheat options and brown rice, whole wheat pasta, etc., as well as lots of fruit and vegetables, dark leafy greens, and lots of omega-3s in the form of fish, and lots of olive oil and other healthy fats like avocados and nuts, etc. So that is essentially the Mediterranean diet in principle. And what they did for this SMILES trial was just modify it slightly to suit the needs of the Australian population. So I think they put like instead of having loads of fish, they put a bit of lean meat in there as well, because that was what they were more used to. And you obviously want people to be compliant with the diet when you are assessing them in a trial. And they had brilliant results. So I think, I can't remember the exact percentage, but I think 40% of the women managed to manage their symptoms of depression through the modified Mediterranean diet. And it just essentially went on to allow them to receive much more funding, much more kind of promotion of the importance of diet for mental illness. And in Australia, they've actually managed to work with the government and get it into policy, as well as medical guidelines for psychiatry and general practitioners to advise patients around their diet. And that's what I'm really hoping to do with my platform here in the UK, because I just think it's so important.
I was going to ask about GPs because I was thinking about who has the potential to have the biggest impact using this kind of intervention, and you know, I was thinking GPs must see the overwhelming majority of like face-to-face care every day. Is there any movement within primary care that's going on in this sort of nutritional space?
Yeah, there's loads of movement. I wouldn't say directly towards mental illness, although my good friend is actually doing her dissertation in that area. So what but in terms of GPs advising patients around diet and lifestyle, there are lots of educational courses and diplomas that GPs have done to be able to have those conversations with their patients, as well as social prescription has allowed GPs to prescribe community walking groups, community cooking clubs to their patients, to really allow them to have that long-term interaction. So there's definitely a huge sweep of lifestyle medicine GPs in this generation, I'd say.
And I think I've just realized how far we've got on into this interview without talking about the awards and the recognition that Nutritank and your work has received. Can you tell everyone at home a bit more about that?
Yeah, sure thing. So it's been a bit of a crazy journey. So we started in 2017, and we started talking to the media quite early on. And I would say that has been really helpful towards getting this message out to the masses. And so Sheila Dillon, who is the host of BBC Radio 4 Food Programme, has been a huge supporter of us from the onset. And then in 2019, we actually went on to win the BBC Food and Farming New Talent Award, which was actually in Bristol. Like, the award ceremony took place in Bristol Town Hall, which was crazy. And it was just the most incredible experience, because it was this really grand event, all before COVID, obviously. And we were just in a room with loads of like chefs, foods, producers, farmers, etc. And we were just medical students. We were like, wow, this is so different, and it's amazing that we've been given this opportunity to be in this space, and we didn't expect to ever win. And then next minute, Jamie Oliver's announcing the fact that we've won, and we go up to collect the award from Andy Oliver and Sheila Dillon. And it was this amazing wooden chopping board with our names on it. And it was just a really remarkable experience. Really remarkable. It's slightly challenging for me at the time, because looking back on it, I'm very grateful for it. At the time, I was actually in a very kind of dark, I was in a very dark patch of suffering from clinical depression. So it had kind of mixed, emotions for me. But that was an amazing achievement. But obviously, to be real with your audience, shit happens, and you can't always appreciate the achievement in the mindset that you're in at the time. And then we went on to I went on to win the Diana Award for Young Changemakers last June. So that is an award through the Princess Diana charity. And Princess Diana, as many people know, was extremely dedicated to activism and social causes and making the world a better place, and a truly, truly inspirational woman. So all these awards kind of look to highlight young change makers' work. And that was really, really amazing. And as part of the award, you get to go visit where she grew up on Althorpe Estate in Northampton and see where she's buried. And I took my parents, and it was a really meaningful experience. It was a shame the actual award ceremony was all virtual because of COVID.
Oh, wow.
Like Prince Harry and Prince William are usually there for you to like say hi to and meet and stuff, but we just saw their faces on our television screen. But it was still really great. But yeah, classic COVID. And then most recently, in January, literally, I found out on my birthday this year, on January the 4th, it was a bit crazy. We got an email through from the Prime Minister's office saying that we'd won the Prime Minister's Points of Light Award. Yeah, so that was really exciting. So that's the roundup. Hopefully more to come.
As far as recognition goes, you've kind of gone the whole gamut, haven't you? Got the royals, the prime minister. Like there's not that much room left to go. Is need like a president from somewhere.
We'll see.
Keep eyes open. Wow. Well, maybe just as a final place to end, Ali, and to wrap things up, I'm sure that there are lots of medical students, and not just medical students, but allied health students and other university students more generally, and professionals as well, no doubt, who are very interested in learning more and developing their knowledge of this sort of nutritional approach to mental health and well-being and physical health. Can you point them in any particular directions?
Absolutely. So you can follow Nutritank on Instagram. It's nutrition_official and nutrition_. Oh gosh, let's say that again.
We'll put the right one in the description.
So you can follow Nutritank on Instagram, Nutritank_official, and on Twitter, Nutritank_info. We also have our website, www.nutritank.com, and we have a really exciting course on weight stigma, tailored to GPs, which will be launching very soon. And we're also on LinkedIn with big updates. And then my socials are at Dr Ally Jaffee on both Instagram, Twitter, and LinkedIn. And just stay tuned for all exciting events. We do lots of different educational events. So actually tonight, which is February the 14th, I don't know when this will launch, but tonight we actually start our man-to-man Nutritank Men's Health Symposium, which is really exciting. So we've got all incredible male health experts, from PTs to nutritionists to GPs with lived experience of how they've changed their own lifestyle around as well as their patients. So we've got that launching tonight, and we have loads of other educational events. So just keep an eye out on our socials to find out more.
Amazing. Dr. Ally Jaffee, thank you so much for coming on.
Thank you so much, Ollie. It's been so lovely chatting to you.
All the very best of luck. I'm sure that we will be seeing many more awards. I don't know who they're going to come from, but I'm sure we will see any more. Take care, Ali. Thank you for coming on. Very best of luck.
Thanks, Ollie. Bye.